The COVID-19 pandemic and the resulting economic recession have negatively affected many people's mental health. During the pandemic, about 4 in 10 adults in the US have reported symptoms of anxiety or depressive disorder. I haven't read a research that gives an actual number of affected Filipinos, but as the pandemic wears on, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health outcomes, such as isolation and job loss. In fact, young adults have experienced a number of pandemic related consequences, such as closures of universities and loss of income, that may contribute to poor mental health. Also, research during the pandemic points to concerns around poor mental health and well being for children and their parents, particularly mothers, as many are experiencing challenges with school closures and lack of childcare. Today, we'll talk about this with an expert who has a special training on crisis intervention, mental health, and psychosocial support for disasters and LGBT psychology. Welcome to Life Expressions. I'm your host, Shari Hineta Elon. My guest today is Dr. Calvin Dave Ganub, RGC. He is currently affiliated with the University of St. LaSalle in Bacolod City. He serves as an anchor counselor for the College of Engineering and Technology. He's also teaching under the College of Arts and Sciences Department of Psychology in the same university, handling both undergraduate and graduate courses in psychology and guidance and counseling. He holds a full Professor II academic rank and had been a meritorious awardee for exemplary teaching and counseling performance for academic years 2014 to the present. Dr. Calvin Dave Ganub took his PhD in psychology at the University of Negros Occidental Recoletos, MS Guidance and Counseling, and BS Psychology at USLS, and is now finishing his second doctorate degree in Doctor of Education in Guidance and Counseling at the Central Philippine University in Iloilo City. His special trainings include addiction counseling, LGBT psychology, and crisis intervention. He is the past president of the Junior Chamber International, formerly known as Bacolod JCs, a leading organization for young professionals. Currently, he is the president of PGCA, Negros Occidental Guidance and Counseling Association. Side by side with his assignment as guidance counselor, Dr. Ganub is actively engaged in research. His researches had been presented and published in various international, national, and local research journals. He has been tapped by various local government units and private and government agencies to conduct mental health, psychosocial support activities. He was also invited as a resource person for various TV shows with regard to psychological and mental health related topics. We could not have a much better guest than Dr. Dave Ganub. Hi, Doc Dave. Welcome to Life Expressions.
Hello, Miss Shari, and thank you for this opportunity to be with you.
I'm so happy that you have time for this, considering that you are very busy. So how's life treating you so far, Doc Dave?
I'm doing great. We just came back from school and we are opening our second semester. And we're so excited to meet our students, our LaSallian students.
When you say meet, I suppose this is still online meetings, right?
That's correct. So we are still in the online learning modality because of the increasing number of infection in the university and the entire Bacolod City.
Do you think the pandemic has actually affected the mental health of Filipinos?
It's not only about the Filipinos, but globally, I think
Yes.
everybody is affected in some ways. But resilience play a very important role also in the recovery process of those people that infected with COVID-19. No? And I think Filipinos are really gifted for that because we just like the bamboo, we keep on swaying whenever there is storm. And when the storm is over, we stand still and become so resilient as individuals. No, when there are TV shows that is covering the people under the flood, typhoon, or any pandemic, we keep on smiling because that is really the way Filipinos are, very resilient individuals.
Yeah, very resilient individuals. You say we're like a bamboo that would just sway wherever we are blown. But how do you think we became resilient?
Okay, resiliency really something to do with support that you get from your families and friends and colleagues. So if you are a kind of person whose support that is coming from these people, you tend to be more resourceful, more kind to yourself, and you're able to take care of yourself so that you can also take care of other people. I think, Ms. Shari, self-care is very important, especially now that we are in the trying times.
Why do you think that others are more affected than the rest? And vice versa, others could also adjust faster than the rest.
So we are seeing that in a multi-dimensional area. So I was mentioning earlier that some people were supported by their families and friends and colleagues, and even the organization. They have supported them financially during their quarantine period. But for some, they lack resources, they don't have accessibility to healthcare concerns, and some of them have really a limiting financial sources. I think these are some of the many factors that affects the resiliency of the individual. That is why they always go back to the self. No, if we know how to take care of ourselves, if we know how to take this challenge, no, we're always seeing things with silver lining, and we have to the situation rather than being stagnant in that particular negative situation. So it's really
Yes.
more of transcendence.
Yes, transcendence. But let me go back, Doc Dave, to what you have mentioned, that taking care of ourselves, it is easy to say, okay, take care of yourself, but many people tend to forget how to actually take care of themselves. So could you please give us some tips how to actually take care of ourselves?
All right. So especially right now that we are living in a VUCA world where there is volatility, uncertainty, complexity, and adversities, it's the perfect time to really look into ourselves. Because I was keep on mentioning earlier, how can we take care of other people if we have that depleted energy within us? So there are so many ways on how to take care of ourselves. One of that maybe is through journaling, through developing an attitude of gratitude. We count our blessings rather than blaming others for our own misfortune. We travel with the practice of minimum health standards, and we always foster positive relationship with our friends and families. So these are some of the many ways wherein we can stresses brought about by this pandemic.
Yes. And you have also mentioned that support plays a key role in the resilience of people. So, in a community, how do we show support to each other?
Well, we started with the online kamustahan. Say, for example, we say hello to each other. How are you? Is there anything that you would like to share? No, by merely the presence of the person would have really an effect or influence of the kind of behavior of the other individuals. No, so we have these two ears. We put them together. It forms a listening heart. By listening, people will try to express what they feel. The negative thoughts will be out, and then it will be changed with positive thinking. No, so we have to calibrate our mind, our thinking, and it really takes a community to build resilience, and it takes a community to really support each other. By doing that, no, we are in a team, as they said. When you are in a team, everything else will be fine because you are not alone in this journey. You have
Yes.
somebody else.
Yes. In the practice of your profession, Doc Dave, can you share with us some experiences that you've had to make sure that there is a community of support, especially in LaSalle or in your organization?
Yeah. Just recently, we went to the southern part of Negros, which was hardly hit by Typhoon Odette, and we conducted the mental health psychosocial support. And I have heard a lot of sad stories of devastation, losing loved one, and it's so painful experience. But with the help of the people around them, by their families, they were able to somehow lessen the impact of that losses. They were able to accept the reality that this is just temporary. These feelings are just normal reactions to an abnormal situation because this is just happening, no, in that particular period, but we will transcend this one no matter what happens.
How do we transcend that situation and that feeling?
All right, we start with again with the self. We start with the self, we do self-care activities, we tend to calibrate our mindset. We have always to apply that crisis intervention principle wherein we see opportunity in crisis rather than the problem. So that's what I mean by silver lining. No? It's really more of staying connected with each other, staying positive with each other, and stay connected and communicate with loved ones, because this is really the primary support that we have, our families.
I think that's what's good with us because we always tend to see opportunities in a crisis. Is there a concrete example that you could share with us that people have seen opportunities in a crisis?
During the lockdown, we had observed that a lot of people are just staying at their house, but it was also an opportunity for them in business. Some of them tried to organize cafes, online shopping activities, and all of these are opportunities for them to really go out of their way and have that some kind of volunteerism activities. No, because during that time, we should be kind to other people, Miss Cherry, even if others are not good to us. No, that sense of altruism, that very Lasallianess of a person for others. I think that is also an opportunity where we can help, even though we don't have so much, but because of our kindness, we help people. And we are so blessed to have that kind of a principle in Lasal.
Yeah, that's wonderful. And you are propagating that principle and that mindset. Earlier, you have mentioned calibrating the mindset is very important. How do we calibrate our mindset?
Again, positive thinking is not always about being positive all the time, because whether you like it or not, we will be experiencing some negative emotion. But with thinking, it's really more of choosing the good ways, choosing to be good, even others are not good to you, choosing to be more proactive and to find more solutions to the problem rather than being part of the problem. So I think this is what we are trying to emphasize here, is really more of really sharpening your edge as a person. You learn something from the experience, you develop insight, but not only insight, but you transform or translate insight into action. No? So
Wow.
something like that, because we should not remain only a word, but we have to do something about our experience or our situation, or else nobody will help us. Nobody can
Correct.
help us except ourselves.
Yes. In fact, we make our choices and then our choices make us.
Yeah,
Correct? Yeah.
that's
In
correct.
every decision that we make, no matter how slight, that would alter the trajectory of our life. It can go up or down. So it is actually your mindset. I like the way you think, Doc Dave. But there are people who still fall into depression and others anxiety. These two emotions, or shall I say, state of mind, can these be prevented?
So depression, usually you are diagnosed with depression if you have isolated yourself for the longest time, you are crying without apparent reason, you tend to be withdrawn, you tend to not enjoy the things that you were enjoying before. Say, for example, you're so engaged with conversation and meeting people, but right now you are no longer like that. So according to the American Psychological Association, it takes 6 months for you to be clinically diagnosed. But I am trying to emphasize here that nobody has the right to diagnose anyone except the psychologist and the psychiatrist. No? So we have to seek help from this mental health professional, because sometimes we cannot control our emotion. We don't want that our emotion will control us, or else it will really result in a negative outcome.
Yes, but can depression be prevented? Can that state, can that, you say, abrupt change in behavior and mindset be prevented?
Of course, it can be prevented. There are treatments available. There are interventions. You can have psychotherapy session or counseling with your mental health professional. You can also seek help from psychiatrists for your pharmacological treatment. This can be prevented. However, if the genes is playing a very important role here, it's really between nature and nurture and the interplay of the two. Because if mental disorder is already there in the family, it runs in the blood, but we have to manage and treat it well. But it's so expensive here in the Philippines because that's part of the healthcare program. That's the challenge in that. No?
Yes, but can you say that, well, if it's not yet on like the genes, on the verge, like in the bloodline, like the way a person think can still be managed and can be controlled, and you could help to calibrate your mindset, as you have mentioned.
That is why you keep on educating ourselves about your mental health condition. We seek help. Doesn't
Yeah.
make you less of a person. We are not alone in this world. We have somebody to journey with us, to listen with us, and to bring enlightenment to our situation. So you have your counselors with you. They are people who are experts in the field who can help you to lessen somehow the impact of the negative situation that you are in. But we will not resolve your problem. It's you at the end of the day who will really be the one to solve it, but we will be journeying with you and share you some alternative options on how to go about your problem.
What's nice in what you have mentioned earlier is that when you do not focus on the problem alone, but shift your focus on the opportunities from a circumstance or a problem, that is where you see a silver lining.
Yeah, that's growth mindset.
That's a growth
That's
mindset.
positivity.
Yes, I agree with that. But I remember a question from Boy Abunda one time in a beauty pageant, and he asked a candidate, "When is it okay not to be okay?" So, is it really okay not to be okay at times?
Yeah, it's okay not to be okay, but it gets prolonged, you need to seek help. Our parameter is the 6 months, Miss Cherry, according to that American Psychological Association definition of mental disorders. 6 months is very crucial. Within 6 months, say for example, you are grieving, you lost your loved one due to COVID, that's all right. If you feel sad, that's all right. It's okay because emotions are amoral. It's neither good or bad. But when you are angry and you displace your anger, say for example, the dog is there, that's another story. Because you're not able to manage your emotions very well. That's fine. It's okay not to be okay, but we have to seek help if we don't know how to control our emotions.
So there has to be that control on our emotions. I remember Ogmandino in one of his 10 scrolls that he said you have to master your emotions. You can be the master of your emotions. So let's talk about crisis, because COVID-19 pandemic is, of course, a crisis. The natural disasters fall into a crisis. So we face a lot of crisis in the past year. How should one deal with a crisis?
Yeah. When we're having a crisis in our life, financially, politically, or health emergencies, sometimes some people do not employ positive coping skills. Some resulted into negative strategies such as too much drinking, alcoholism, substance abuse, which is very self-defeating behaviors. If we want to help ourselves, then we have to follow that certain positivities, in terms of strategy. So we try to take care of ourselves again, and then we connect with people as much as possible. We don't go out. We stay at home if it's necessary. Okay, so that we cannot also spread the virus within us. Because if we really take care of ourselves, if we really love our families and friends, we don't want to spread the virus, but we want to spread the love and kindness to each other.
It's wonderful. Doc Dave, we talk about ourselves to make sure that we help ourselves. How about the community that we live in, like our family, our neighbors who might need our help? How do we extend help to them if we can?
Very important that we will have a meaningful engagement with our neighbors. Try to check our relationship with them. How are we? Because we Filipinos usually, if there's enough food, we share over the bakod, right? So that is really a practice among Filipino. But how are we in terms of our relationship with our neighbors? Are we having a good relationship? Are they good or bad influence to us? Because sometimes in a community, we cannot deny the fact that they are very hostile members of the community, even our own family. That's why I think very important that we stay kind to them. We engage them in a manner that is also very respectful. That sense of respect, that sense of engagement, and that sense of privacy also. We don't want gossips because that is very detrimental to the whole community, and chismis is not good after all.
Let's talk about psychological support. Can one help someone needing psychological support? Or are we able, like me, I am not a psychologist. Can I help someone needing psychological support?
Yeah, so we have this what we call psychological first aid. So this is a model used by the Department of Health at the same time with the World Health Organization, wherein para-professionals like you who are not really psychology major can also help, no, in the principle of linking people, listening to them, and looking after their needs in the part of recovery. So just like say, for example, giving relief goods is one, trying to link them. Oh, you need this kind of thing. So these are your barangay health worker. This is your barangay captain. This, where are your family members? Because of the typhoon, you cannot see them. So we have to link people, and that is already a part of helping them because you care for them. You show your concern to them, and merely your presence can have a big impact also on the lives of the individuals.
That's very nice. And Doc Dave, you have mentioned so self is important, but you also extend yourself. So it is like a process that you have to observe and to be able to be a positive influence, not only to yourself, but to the community as well.
Yeah, we call that in social psychology altruism. We call that
Altruism.
pro-social behavior when we are not only after ourselves, but we are also after the concern, the welfare of other people. Just like what we have noticed during the pandemic, Ms. Sherry, if you have noticed, we have a lot of community pantries.
Yeah.
No, it was emerging. It is existent out of love of people to really help them to extend kindness to other individuals who are in the dire need of these basic services. So I think that is one good indicator that Filipinos are very kind and also taking care of the welfare of each other.
Yeah. Let's talk about you, Doc Dave. What do you think is the most rewarding experience being a psychologist?
Being a mental health professional, I think the most rewarding is not always the monetary. We go beyond monetary rewards, but it's really more of the psychic benefits that we are getting from our clients. Say, for example, one of my professor told me that a mental health professional, a psychologist, a counselor, is of angelic profession because we enlighten people on the problems that they are experiencing, and through our process of counseling they will able to come up with wise decision that will not better only themselves but also with other people. I think that is the very good benefit, and then when they go back after your session a week from now or 2 weeks from now or a year or whatever year is that, they would always say, thank you, Doc Dave, for your help. It was really a great effort of you that you are helping me, and I was able to thrive and survive those crises that I have experienced. I think it makes my heart full for that matter. No, not really the secondary ang monetary rewards after that.
Yes. And what so far, what do you think is the biggest accomplishment that you have achieved in your profession?
I think it happens one of my student in the university had engaged into substance use disorders, and it was I think 5 years ago, and right now he is so very successful. He is already a colonel, in the Philippine Coast Guard. And one time he messaged me during Christmas break, and he told me, sir, I will visit you because I am so thankful that you straightened the path for me, because I thought that was the end of my life and my career because I'm into drug addiction. Because Miss Chari, I'm also into addiction counseling. So it was really a great help for them to enlighten him of what is the effects of drugs to him, to his family, and to the financial, because of the rehabilitation that he has to undergo. But what's important is that he was able to survive those situations and become successful in his chosen career right now. So I think that was really more rewarding for me to work as a mental health professional, especially when we are transforming the lives and we're making a difference in the lives of our students and maybe our faculty or those who are needing help also.
Yeah, wow. That's a huge impact that you have made on his life. You have mentioned, and I have also read in your bio, that you also have training on LGBT psychology.
Yeah, so I had a special training on LGBT psychology in the University of the Philippines, Diliman. So my mentors are from UP, and I think that is very relevant right now, especially when a lot of LGBTQI members are being stigmatized and discriminated because of their sexual preference. I think it always boils down to our basic human rights. right? And that is to respect regardless of our race, colors, tradition, or even our background. Because these people are so creative people. They are everywhere. They are in media industries like you. They are in academia. They are in human resources. They are everywhere. And I think they also make a positive contribution to our society.
That is very true. Doc Dave, if there's one thing that you'd like to leave our audience to help them become the best person that they can be despite the crisis, despite the things that are going on in their lives, what would that be?
I think we have to embrace that lifelong learning values because the more we know, the more we are empowered, because knowledge is and I always believe that little knowledge is dangerous. That is why very important that we have to learn, relearn, as much as possible. Because maybe I'm coming from the university perspective that even as faculty, even though you have so many degrees in but we keep on learning because after all, through our learning, through our experiences, we gain a lot of wisdom and become a wiser individuals that we can impart also to our next generation.
That's wonderful. When do you think you could say that, yes, I have done my part, I have done my purpose? What is your purpose?
I think my purpose is not only imparting the knowledge that I have, but also training and mentoring young professionals. No, so I am also blessed that I have been mentored by fellow psychologists and counselors, and they are not really that greedy in sharing to me their expertise, and I want that to replicate also to my students because when they become a mental health professional later on, although they will not become rich financially in this profession because you are gaining more of experience and relationship, but it's really more on the impact that you are giving to the lives of the people under your care. So I think that's it, Ms. Chad. That's my purpose.
Wonderful. And you are living your purpose, I would dare say.
Yeah, we have to walk our talk and talk our walk.
Yes.
We have to be a role model to our students so that we become credible also.
Yes, definitely. Doc Dave, my final question to you, what is your prayer for yourself and for the people around you?
My prayer for myself is to continually effect change in the lives of my student and to keep me healthy and entire my family. I cannot ask for more. I'm so blessed, despite the pandemic. So I have really what you have said earlier that hopefully this pandemic will end and hopefully everything will be all right. I think
Thank
that's it.
you.
Thank you.
That's
Thank you
wonderful.
very
Thank you so
much.
much for sharing your knowledge with me and my audience here in Life Expressions, this podcast. Thank you so much. And of course, you have shed light on how to calibrate our mindset and to move forward despite the crisis. Thank you.
Thank you very much for the opportunity and stay safe always, Miss Cha.
You too, Doc Dave. Thank you. My guest is Doc Calvin Dave Ganub. Thank you so much. I'm Shari, your host for Life Expressions.